I have two more questions for both Sean and Kate. As we know that we have seen an increasing number of deaths and confirmed cases in the U.S. and also the World Health Organization has seen Europe as the new epicenter of the pandemic. So what should be the next step in coping with the new virus in Europe and in the U.S.? Sean, please, you first.
Well, I think the difficulty in Europe, Europe is a collection of different countries, and so each government in Europe will be making different decisions based on its population. So we've all been looking at Italy, where that's the epicenter for Europe, and the estimate is that we're a couple of weeks behind, which is why I think you've seen an increasing emphasis on social measures, the lockdown, the increasing lockdown, and I think that's what we're beginning to see, increasing lockdown in most of European countries. Travel is severely restricted, people are being asked to stay at home, schools and universities closed, and everyone asked to make as much effort as they can. I fear that should hopefully. I keep saying to people, this too will pass. I remember SARS in Hong Kong and the feeling of as the cases were increasing and how you felt so hopeless at that point when cases were increasing. As they start to turn, things become more optimistic, as you found in Wuhan, as Korea had found until it began to get imported cases. So we need to be very careful to avoid re-importation of cases once we're on top of the disease in Europe. I fear for other countries with less strong healthcare systems. I think European healthcare systems are fairly robust. I think in sub-Saharan Africa the threat is way greater. And I think we should all be thinking globally, not just thinking locally. And what do we do together globally to mitigate against this disease? So that's our next big challenge, I think.
Yes, in the U.S. you'll see increasing lockdowns and increasing social distance. They're already starting to build the auxiliary emergency hospitals now. And as I was discussing before, also seeing how much they can shift to community-based care, that people who just require medical oxygen might be at home or in a community center. But as Sean said, there really needs to be a push for a vaccine and other treatments. And I've been very encouraged by the degree of data sharing amongst healthcare workers. The fact that the Chinese team shared the gene sequence has made a huge difference. And we need to keep this up, keep sharing what works, what doesn't work, combine the data so we can find out what therapeutics work. And also I share Sean's concern about some of the low and middle income countries, particularly in Africa. I think unfortunately there was a false sense of security that their hot climates, the virus wouldn't transmit very well. But even if they have an outbreak 1/10 of what you see in Italy, their health systems will be overwhelmed. Yeah. So I'm very concerned about that. And it's hard to know how we can help because we're not in a position right now to send healthcare workers because they're needed at home and there are all the travel restrictions. So at least we can share the data and share the best practices. I know my team is working on a surge staffing plan for a country in Africa. We just need to share all that as much as we can.